Hi, my name is Kartike Gulati. I'm an otolaryngologist, or ear, nose, and throat physician. I've done a subspecialty as well in otology or neurotology, and that's just complex surgeries of the ear. I practice with Specialty Physicians of Illinois. So I started out as an engineer at the University of Illinois, and then I switched careers and I went into medicine. So my philosophy of care is communication, and a shared decision-making model with the patient is extremely important. That's because every patient comes from a different background, and some patients' problems are quite complex. The patient-doctor relationship is critical. I believe that more than 80% of diagnosis comes from our history, and the communication that we have with the patient is really where the history comes. So that relationship, or even trust if you want to call it, is critical in the sense of obtaining the full history. And this does require time, and it requires a component of trust, and it requires listening to each other and communicating with each other. So a little bit of history about me is I am married, I have a wife, and I have a son. And we've been traveling a little bit due to my training, and we finally came home. I grew up in Naperville, and we spend much of our time with family activities. I do enjoy sports. The most important advice I would give to patients is ensure that there's good communication between the doctor and the patient, because that's the number one most important part of the relationship. There should be complete transparency between a doctor and a patient, and it should almost feel like a casual conversation.